You know, among the many horrors of the Assad regime, the deliberate and repeated bombing on hospitals and healthcare workers, I personally find particularly outrageous. Uh, this panel you'll hear today will be discussing that, talking about how to protect health workers and vulnerable injured in this conflict zone. Our moderator is our own Ibrahim Asli. He's been with us for a couple of years now. I don't know how we got along without him before he came to us. Ibrahim was co-founder in 2011 of the Syrian Nonviolence Movement in Syria. That's an NGO that promotes, of course, peaceful civil resistance to achieve change in the country, and he paid his price for it, so we're happy to have him here now, but I'm sure he would be anxious to be back in his own country trying to do what he can do. But he's doing what he can do here. Ibrahim will introduce the authors of the report that is being launched by the panel today, and then he'll moderate the discussion. We'll end promptly at 1:30. So, 2 o'clock? Okay, sorry. Ladies and gentlemen, let me turn it over to Ibrahim, who will welcome the rest of our panelists. And thank you so much for joining us.
Thank you very much, Ambassador Chamberlain, for the very nice introduction. And good afternoon, everyone. Thank you very much for being here today with us to discuss such a timely and very important topic about fortifying hospitals inside Syria. We have four very distinguished four panelists today who have been working with NGOs inside Syria for years now. Some of them visited Syria even recently. I'll introduce them, and then I'm gonna turn it over to them to hear more about their experience and what's happening on the ground, their recommendations, and why they think the policy they are suggesting is very important. I'll start with my far left. We have Kathleen Fallon. Kathleen, she is one of the authors of the report, co-author of the report. She is Senior Humanitarian Advocacy Lead at the Syria campaign. Kathleen is the author of the report, Saving Lives Underground, a Case for Fortified Hospitals in Syria. She works closely with humanitarian Syrian groups, medical professionals, and Syrian civil society organizations. Before joining the Syria campaign, she was the advocacy manager at the Syrian American Medical Society, SAMS, where she collaborated with Syrian medical professionals and NGOs in the health sector. She previously also researched and authored a report documenting over 160 chemical weapon attacks in Syria and analyzing those attacks and their effect on health workers. To my immediate left, I have Dr. Bassel Terminini. He is the Vice President of the Syrian American Medical Society. Dr. Terminini is also a member of SAM's Turkey Regional Committee, which oversees all SAM's medical relief projects in northern Syria. He has visited Syria 7 times since 2013. Most recently was in October 2016. He has also visited underground facilities in Idlib and helped establish 2 advanced endoscopy centers in Idlib, Syria, and Rehanli, Turkey. To my far right, we have Dr. Mahmoud Hariri. He is general surgeon from Aleppo University, Faculty of Medicine, and he's currently a fellow at Harvard University at the Harvard Humanitarian Initiative. Dr. Hariri is general and trauma surgeon from Aleppo. He was the scientific vice dean at the Aleppo University Faculty of Medicine before the Syrian conflict started in 2011. He has practiced surgery and emergency medicine at one of the largest hospitals in East Aleppo, in the east side of the city, throughout the conflict. He left East Aleppo in mid-July 2016 for a fellowship at Harvard University. To my immediate right, I have Jumana Qadour. Jumana is a co-founder of Syria Relief and Development. Which is a humanitarian organization providing direct emergency and ongoing humanitarian relief for Syrians since 2011. Ms. Qadour is also policy analyst covering Syria, Iraq, and Turkey at the US Commission on International Religious Freedom, and she is currently working on her LLM at Georgetown University. Now I'm gonna turn it to you, Kathleen, to tell us more about the report, what are the main findings and the main recommendations. Thank you.
Thank you. Thank you, first of all, so much to MEI for hosting this panel and for centering this very important topic and highlighting this report. I'm Kathleen Fallon. I'm with the Syria campaign. We're an independent advocacy organization that works to elevate the voices of Syrian civil society and Syrian humanitarians. And most recently, we've been privileged enough to work with 13 of the leading Syrian medical organizations, including SAMS, OSAM, and SRD, to put together this report, Saving Lives Underground. And as many of you know, field hospitals inside of Syria have quite literally been driven underground into caves and into basements. And these underground and fortified facilities have saved countless lives of patients and medical staff, while the international community has failed to protect Syrian humanitarians. It's the medics themselves who have created these fortified facilities to offer their colleagues and their patients the best protection possible. So to back up a little bit and just give some context, healthcare in Syria has been weaponized, targeted, and denied since the very beginning of the peaceful revolution in 2011. From the very beginning, peaceful protesters were detained, tortured, and the Syrian doctors that treated them were also arrested and detained. Soon, healthcare professionals created field hospitals that were essentially makeshift hospitals in farms, in their own homes, and in different buildings. And as the systematic attacks against hospitals increased and as aerial attacks became a center point of the strategy, they adapted their best practices to include underground facilities. And as you can see, most recently, there have been over 450 attacks on hospitals in Syria. 91% of those are by the Assad regime and Russia. So while all parties to the conflict at this point have violated IHL and have violated the principle of medical neutrality, it's overwhelmingly led by the Assad regime and allies. This also dramatically increased in September of 2015 with the Russian intervention. Before the Russian intervention, there was an average of one attack on a hospital every 4 days. After September 2015, it became once every 2 days. And just last month, in April, it became one every 29 hours. And in addition to that, there have been over 814 medical personnel who have been killed inside of Syria, mainly from these systematic attacks on hospitals, as well as the detention and arrest and torture of medical staff. But according to documentation from the Turkey-based health cluster serving Syria, there have been no deaths of medical staff from direct attacks on fully underground hospitals. So these underground facilities are really doing their job. So this is an example of one of the cave hospitals in Hama in Syria. And for this report, we interviewed and gathered testimony from 25 medical professionals working either fully underground or in splitting their time between both underground and above ground facilities. And I just wanted to read a few of the bits of testimony that we got from them because they very much re-emphasized the protective power of underground and fortified medical facilities. So staff have said that medical staff feel safe in the cave. You do not see the raw fear in the eyes of staff in the cave as I see in other hospitals. The only way to protect medical staff is under the ground. There is no other way other than to stop the airstrikes. We are not 100% protected underground, but we are safer. Underground, you will maintain your equipment. It will not be damaged. You will protect medical staff. You will save lives. Being underground will encourage people to come to facilities when they need treatment because it will be safer. So to meet these needs, Syrian medical groups work with incredible Syrian engineering groups to put together extreme measures that have essentially become best practices in fortifying hospitals and in moving hospitals underground. And for the sake of time, I won't go into all of them, but they include having a certain number of basements, using sandbags and external walls to fortify facilities, having what's termed as sacrificial floors above facilities to essentially cushion the impact of airstrikes. One very important aspect is proper ventilation. So particularly when we're thinking about chemical attacks, which have also been systematic in Syria, proper ventilation systems can be the difference between life and death for medical professionals and patients in hospitals. And so one of the many examples of an underground facility is one that's in the final stages of being built, the Avicenna Women and Children's Hospital, which is in Idlib. And this will be one of the largest underground hospitals in all of Idlib. It's a referral hospital that specializes in maternal and child health services. They'll provide specialty surgeries for women who are pregnant dealing with very dire conditions. And they'll also be providing trainings to staff on how to perform C-sections and other life-saving forms of medical treatment. So one other theme that came from the testimonies we collected from staff working underground was that as the level of fortification increases, so as there's additional protective measures on hospitals and medical facilities, they're met with increasingly destructive weaponry that targets the hospitals. So bunker busters in particular have been targeting the most fortified hospitals, and chemical weapons have been being used on cave hospitals and fully underground hospitals. And so these two types of weapons really serve additional challenges to the building of underground facilities. In particular, bunker busters can pierce the surface of the ground and can destroy entire underground shelters. And then chemicals are heavier than air, so they sink. And so in a chemical weapons attack, being underground is really the worst possible place unless there is proper ventilation. So this again just reinforces the need for proper engineering studies and technical engineering expertise to actually be building these underground hospitals. Just on a lighter note, in addition to the fortification of hospitals, there's many different ways that Syrians and Syrian medics are also helping to self-protect themselves and self-protect their colleagues. Early warning systems are one of the most critical, and there's different forms of early warning systems, including spotter networks that include walkie-talkies between rescue workers, medical professionals, and others. But one that we like to highlight is actually a pet dog in one of the cave hospitals in Hama. This is a dog named Rocky, and Rocky's been trained to identify the sounds of warplanes approaching the hospital and to bark and alert the medical staff that one's coming. And when you look at attacks on underground hospitals, there are deaths from those attacks, but they're typically from staff or personnel being in the entranceways or in the above ground portions. So early warning systems are critical. And then just very quickly, in addition to these medics emphasizing the need for this form of protection, the Strategic Advisory Group for the Turkey-based health cluster has made similar recommendations. So this is a group that's comprised of the WHO, all of the major medical groups working in Syria, as well as the Idlib, Hama, and Aleppo health directorates. And when they've made these recommendations for the protection of staff, they also focus on the fortification of existing hospitals and the construction of self-contained underground fortified hospitals. And then finally, I'll end here. Of course, at the end of the day, the only way to fully protect medical personnel and patients is to prevent attacks on hospitals and all civilian infrastructure from occurring. But in the case of Syria, where there's systematic attacks on hospitals happening, underground facilities are far more protective than above ground facilities. And 3 points that we emphasize are that these hospitals are saving lives. As we've said, there have not been any medical staff who have been killed from a direct attack on a fully underground facility. They're also protecting donor-funded equipment, and over time are quite cost-effective. So many hospitals in Syria have been hit a dozen, 24 times, and have had to switch locations 4 or 5 times. And over time, the damage can actually amount to hundreds of thousands of dollars of equipment, most of which is provided by donor governments. There was recently an attack on a facility where there was $600,000 worth of equipment that was damaged or that was lost from one attack. So over time, fortifying one hospital or creating one underground hospital that protects equipment is quite cost effective. And then lastly, it limits displacement. So within Syria, the attacks on hospitals really are aimed at destroying communities and displacing them. Without medical services, emergency services, as well as primary health care, civilians aren't able to stay in their own communities. And in opposition-held Syria right now, there's only 1,070 physicians for the entire opposition-held areas of Syria. And just to give contrast to what this looks like globally, there's an average of 13 doctors and 28 nurses for every 10,000 people. In Syria, it's 2 doctors and 4 nurses for every 10,000 people. So even, which this is not the case, even if there were state-of-the-art facilities and ample medical equipment and medicine, lives would still be lost because there's not enough qualified medical professionals who are able to treat people.
Sorry to interrupt, Kathleen, but I just want to make sure that we'll have time for questions,
Absolutely.
because I'm sure they have tons of questions for you about that. So if you don't mind, can we move to Dr. Terminini also?
course.
SAMS is one of the main 2 organizations worked on the report. So would you please also share with us more about SAMS and the main recommendations that SAMS also think it's or should be the priority?
Thank you, Ibrahim, and thank you for inviting me to present SAMS. I would like to congratulate Kat and Natasha for outstanding report. It's really comprehensive and has very good points, as if they were visited Syria, were on the ground, so congratulations. Now SAMS, can you get those slides, my slides?
Of course.
SAMS is a professional organization. Syrian American Medical Society represent around 6,000 healthcare providers of Syrian descent in the United States. We have more than 1,200 members and 26 chapters. SAMS Foundation started as a charity arm for SAMS in 2007, 10 years ago. Quickly we had to deal with, it's a 501c3, non-for-profit, non-political, non-religious organization. We had to deal with the Syrian crisis only a few years after we started. This is the worst humanitarian crisis of our lifetimes. More than 500,000 people killed, 1 million injured, and half the population, more than 12 million people, were displaced. So SAMS Foundation responded aggressively. We had a budget of $100,000 in 2011. Our budget this year is $33 million. We had 1 staff member. Now we have more than 120 staff members in 6 different countries. We also support more than 1,800 healthcare providers inside Syria. We are the most active medical relief organization on the ground in Syria. And we also have more than 192 facilities in Syria and surrounding countries. We treated 3 million people last year. The majority were inside Syria. And our numbers have doubled over the last 2 years. From the 192 facilities, we have 26 hospitals. Many of the hospitals in this report came from SAMS. We have been pioneers in underground facilities. And we operate in all areas in Syria except those controlled by the Syrian regime or ISIS because of safety concerns. Those are our 2 facilities. We started in 2015. We started operating in 2016. They were listed in this report extensively. One of them is a cave hospital, which is underground, full hospital, 4 ORs, ICU, and an OR and an ER. And the other one was started from scratch, also in Hama province, eastern Hama province. They were very expensive at that time. We had no funding. We had to use private funds for them. The attacks, as Kat said, intensified, and especially the second half of 2016, they coincide with some kind of movement at that time where destruction of Aleppo, destruction of all 4 hospitals of SAMS and other facilities to force the population out. They also intensified just before the chemical attack on Khan Sheikhoun. 4 hospitals were destroyed completely, as before there was a smaller attack with a combined sarin gas and chlorine, and they studied the evacuation route for those patients from Hama, from Khan Sheikhoun. They destroyed all 4 hospitals regionally and the largest regional hospital in Idlib. So in December, the attacks averaged in November, December, 1 attack every 23 hours. And in April, the attack frequency was 1 attack every 29 hours. This is one of our fallen heroes. The report was dedicated, and thank you very much, Kat, for doing that. Dr. Hassan Al-Araj, he's one of the pioneers, a good friend. He's the only cardiologist left in Hama province, and the idea of the cave hospital and the underground hospital came from him. He had a vision, and he was very articulate and a voice for all the doctors. He went to Geneva and Qatar as a voice of the Syrian doctors. He was assassinated by an air missile targeting his car. He was the only occupant of that car, traveling from the cave hospital to a nearby facility to interview paramedics for an ambulance system in Hama. So they knew where he was going. Now, our priorities in 2017 as SAMS are underground facilities. It's number 1, 2, and 3. We need to move all our facilities underground because of the frequent attacks. It's not unusual for a facility of ours to be targeted more than 20 times. And the movement can be simple as reinforcement, moving all the vital structures underground, like operator rooms, ERs, ICU, but that doesn't give you the best protection. It has worked, but then was costly. It cost us hundreds of thousands of dollars to rebuild those structures. The best thing actually is a cave hospital. The cave hospital is more cost effective, but it's limited by geography and the topography, the type of rock formation. So if not built properly, those cave hospitals have not stood the attacks. There were, I can show you later, but one of our doctors was killed in a cave hospital because they didn't follow the standard. We need to have at least 10 meters of rock formation and the special rock forms. So they are a good option, but they're not available everywhere. And many times they're only available in remote locations. So people going to those hospitals will be targeted, the ambulances and the patients. Now the new underground facilities are the most expensive form, but they work very, very well. The problem with them in areas under siege, the material is not available. This is what happened in Aleppo. We started a huge project before June to build the Move M2 hospital. But then we had to stop because of the lack of building materials. Now, all those underground facilities turn into death traps when chemical weapons are used. Those chemical agents are heavy and penetrate very deep. So the only way to address that is with reverse ventilation. None of the facilities we have right now does have that reverse ventilation. It's extremely expensive. And we're working on that with the State Department, trying to get the equipment necessary for that. But it's still a very expensive project. This is Dr. Darwish. He is the one who died in that cave hospital in Al-Latamne. He died in the line of duty, insisted on finishing a surgical procedure he started. All these other staff members left, but he stayed for an extra 10 minutes to close the patient and paid his life. He had 5 children. Those are the 3 youngest children. He was a great person. So the examples of underground facilities before and after. Underground doesn't mean that we are, cut any corners. They are nice ORs, nicely built and furnished. This is an ICU at the Cave Hospital. This is from my last visit. Those neonatal unit looks at any other neonatal unit in the United States, but when you look carefully at the left-hand corner, you see the sandbags used for enforcement. This hospital, this is a regional hospital in Idlib, was attacked at least 12 times. This specific unit was destroyed 3 times. This is an OR when I visited the hospital in October, 24 hours after a school attack that killed 36 people, mostly school children, teachers, and 2 doctors who rushed to the scene to follow up on their children. This is the same OR was destroyed 2 days before the chemical attack in Khan Sheikhoun. This was not basement, unfortunately. This is one of the school children I visited before. This is the same room after the attack in Marf al-Naman. I'm going to leave you with this image about the Syrian people. This is a child displaced from Aleppo. You can see all the suffering, but you also see the resilience and defiance and the hope in his eyes. So thank you very much.
Thank you, Dr. Termini. And I think now it would be great if we follow up with Dr. Hariri to know more about the situation on the ground from your experience, especially in the eastern side of Aleppo. Let me get you your presentation. Yes. Please.
Thank you so much, Raheem. Thank you for your time and thank you for having me here. That's one, the middle, or?
Yeah, just to the right.
Just a second, okay. So, I'm Dr. Hariri, I'm General Surgeon from Aleppo, and I'm back to Aleppo, hopefully soon. This is one of our hospitals, just an example about our work. At the beginning of the revolution, when the war started, we were living in one of these hospitals. This is one of our hospitals, just close to my hospital. We used to stay in the maybe second or third stories. But later on, when the targeting of this hospital being more intensive, we started to protect ourselves with these sandbags. But later on, we moved to underground, and maybe, I don't know, maybe go to the nuclear of this ground, I don't know. Still continuous. And this is one of the example in MSF hospital in Marra. This is before and after. The regime used double attack tactique, and this is the example. You see this hospital before being targeted. He targeted this hospital at 9 a.m. and 9:30 target the hospital again to have more casualties and more people. More than 18 has been killed. One of them is orthopedic surgeon. And at 11:30 in the same day, after 2 hours, the nearest hospital also targeted, and we lost many patients on the table. This is my hospital. This is the entrance of my hospital in Aleppo, and this is, you see the sandbags, this is patient room. To be honest, many times I was hesitated when I was working, doing surgery for a patient in the hospital, and feeling, shall I risk my life to continue this operation or not? Because every time you are expected that you will be targeted. And even when you are sleeping in the night, you do not believe that you will be wake up or not. Which wall will be above me, this one or this one? I left Aleppo last June, and up till now, when I'm hearing helicopter in the sky, feeling afraid, to be honest. Maybe any barrel bomb could be sent here. I don't know. This is again my hospital. This is one of the ambulance at the door of the hospital. Ambulance is just like landmark. This phosphoric color, we used to change it, but unfortunately this one did not change it before, but it's targeted. And this small machine, it was mobile oxygen generator, which is moved from a hospital to hospital, which is funded by our colleague in SAMS. And it was very generous and very great invention, but unfortunately, again, we lost it. This is M2 hospital. So recently, we working awesome on many reports for hospitals infrastructure in addition to information about workload, monthly visit for the hospital. This report has been released recently about infrastructure hospitals inside Syria. Anybody if like to see it, we can see it. Just example, this is a 5 regions we studied inside Syria. 2 regions in the middle are besieged since 3 years right now, and the other 3 regions have connection with either Turkish border or Jordanian border. So in this hospital, this is just in numbers, number of the beds available for all of more than 6 million population inside the country. And this is type of the hospitals. Originally, we have only 26 hospitals were hospital before, but the rest of them, you see, some of them are schools, and recently, as Dr. Termanini mentioned, we're working on cave hospitals. And this is number of targeting, either direct or indirect, during this period of 6 years. So the most alarming thing is the number of health staff, human resources. In numbers, our statistic in 2015 to 2016, we have declined in the total number more than 30% of the doctors. Example, for surgeons, in 2015 we have 170 almost, and now we have only over all Syria 120 general surgeons. The same for orthopedic surgeon. So this is the most alarming things we have to consider talking about underground hospital. This is a figure of Syria for, as mentioned by Dr. Termanini and Kathleen, about the number per 10,000. You see that the average in the world 25, and recently in Syria 3. This is for the beds, and for the physician 2. This is just in numbers, the workload. We have in 1 year more than 4 million visits to the hospital. In a year, we have 4 million visits between ER, almost 40% to the emergency room, and the rest to the outpatient department. We have more than 1,300 deaths in hospital. That means those patients came alive to the hospital and died in the hospital. We have also huge number of amputees, patients with amputation. We have also the numbers of patients under 5 years old, male and female. All of this will be released soon in a report. Thank you.
Thank you very much, Dr. Hariri. Jumana, while we were listening to those comments and very important remarks, I was thinking about the policy priorities. We hear a lot now about the de-escalation zones and the ongoing debate in Washington, D.C. about that and the importance of that and what that could mean for the humanitarian work inside Syria. From your point of view, from the NGOs that's working inside Syria point of view, what should the priorities be for the current administration?
Okay. Thank you, Ibrahim, and thank you, MEI, for hosting us, and for Kat and Dr. Termamini and Dr. Hariri for the great remarks. I represent a humanitarian organization that also helped contribute to this report, Syria Relief and Development. In terms of priorities, I think since I'm here in Washington, there's three main, I think, policy priorities that we need to keep in mind that are relevant and that this administration has the ability to build on or potentially impact negatively if certain decisions are made. The first thing that I think is the most important to all of our nonprofit organizations is the budget. And as many of you know, the budget is likely to be cut anywhere to 31%. And a lot of that funding is going to be cut from international programs and foreign aid. Aid that organizations like mine and SAMS and the Syria campaign really benefit from. I mean, without the United States as the most generous donor really leading in the humanitarian funding space, the conditions on the ground are only going to continue to worsen. So I would say that is the #1 priority for all Syrian American and Syrian nonprofits. And keep in mind that if they are not Syrian American organizations, that our government does fund a lot of local grassroots Syrian organizations, civil society organizations as well that need this funding. The second priority is obviously civilian protection, protection of medical workers that my colleagues have spoken extensively about and that I'll go into a little bit further in my remarks. But that has to be a priority, is saving whoever is left in Syria, civilians and medical staff, because without them, even if the conflict were to come to an end, there will not be anybody to help rebuild Syria. And as we know, the refugee crisis is already, it has only become worse with time, and the refugee flows have not stopped. And with our country here sort of halting the resettlement program and other countries following suit, we need to find a way to keep people inside of Syria safe. And the third point I would say is a banking de-risking issue, which I don't know if many of you are familiar with. Many nonprofits that operate in the Middle East and North Africa are unable to operate because a lot of banks see the word Syria or Middle East or Arab or anything related to that and automatically close bank accounts or stop the wire transfers. Now, many of our organizations actually transfer those funds on behalf of USAID or on behalf of DFID or on behalf of the UN, and we go to the banks and tell them, this is funding that has come from sources, and we are implementing this work on behalf of governments to help meet their mission in saving lives. And it still has remained a complicated issue that we've tried to coordinate with banks and others on. So I would say those are the three top priorities for NGOs. I just wanted to make a couple of remarks, both about my organization and just in general about the medical situation in Syria. So as I said, I represent Syria Relief and Development. We have been around since 2011. We've distributed about $35 million worth of aid, have helped about 1 million beneficiaries throughout Syria, and have about 700 employees throughout different parts of Syria. We operate in the north, in the south. We used to operate in places like Deir ez-Zor and Raqqa, and obviously that's become impossible given ISIS's takeover of those areas. Our organization has suffered from the very attacks that my colleagues have spoken about. I'll give you one example. One of our primary hospitals in Aleppo has now had to move locations 4 different times. I remember on Christmas Day in 2015, the Russians hit our hospital twice, as Dr. Hariri alluded to, the double tap method, where they hit the hospital, wait a short period of time, and then hit it again, as soon as white helmets or other aid workers come to the rescue. Right now, we're completely underground in many of these cave hospitals, as my colleagues have spoken about. When we really saw this major, when we saw the hospitals change, really move in the direction of completely underground, was when the Russian involvement in Syria intensified. And in September 2015, when Russia, started bombing directly inside of Syria, we did see a difference in the type of missiles that were even used. And doctors told us that the missiles were much stronger, and so therefore able to penetrate at a much deeper level. And so that's when many of these hospitals took an affirmative decision to go completely underground. Before you used to have maybe 50 doctors or patients, etc., that were killed when hospitals were above ground. Now we have maybe one person, and usually that person is above ground when he or she is injured or killed. So it's dramatically decreased the number of deaths that we've seen in Syria. Just in general, we've the current ceasefire, we speak frequently to our teams on the ground. They said that they have seen some tangible effect from the ceasefire, that the number of deaths have decreased. Now the problem is, because of this ceasefire, a lot of people are moving around. There's a lot of people displaced. And for example, the neighborhood of Al-Wa'ad, the neighborhood where I was born in Homs, Syria, a lot of those people have been displaced now to other areas in Jarablus and to Idlib. And in the north, both Jarablus and Idlib are located in northern Syria. And now you have a great number of displaced people there that the already dwindling number of doctors cannot treat. As Dr. Hariri was mentioning, you have about now almost in the upwards of 2.5 million or 3 million people in Idlib. You have maximum maybe a few hundred medical workers. That includes pharmacists, doctors, nurses, etc. So not just doctors. And that's really a problem, especially as Dr. Hariri was saying, in terms of the surgeons, because you can't just throw anybody in the operating room and ask them, to act as a surgeon. Maybe as a pharmacist or nurse, you may be able to train. In the past 5 years, we've been able to train people to become pharmacists and nurses, but it's very hard to train someone to become a surgeon in such conditions. Lastly, I'll end that although I agree fully with my colleagues that the Assad regime has been the #1 killer of civilians and medical professionals in Syria, many of our doctors have ISIS has tried to kidnap many of our doctors as well, because they don't have doctors in their areas. So what they've tried to do is kidnap many of our physicians in Aleppo and to try to take them into their areas forcefully to treat people there. So I will stop right there and
Thank
open
you
for questions.
Thanks, Jumana. And before we move to your questions, I'd like to mention that we have hard copies of the report here. Thanks to SAMS and the Syria campaign. Feel free to get one from here, or that we have also some copies downstairs. If you have a question, we have a mic in the room. Please introduce yourself and your affiliation. And if you would like to direct your question to one of the panelists, or just leave it up to them to choose to answer that. You'd like to wait?
No, I have a question.
Sure.
So what happened back there?
Yes. The mic is coming, yeah.
Thank you all very much for your work. I hope someday your data will lead to a war crimes tribunal. I wanted to ask about the Aleppo boils. I know that some of the refugees that are leaving Aleppo and going into Lebanon come with this illness and are isolated there. I also want to ask about, you had telemedicine up there, and I wonder if somebody could just say a word or two about that. And I wonder if any of you have heard of the Cat Man of Aleppo. It's on Facebook. There are thousands of followers. And we've learned a lot about the situation through this Cat Man.
Sure. But Catman?
Yeah.
Yeah. And,
No, I don't know. I didn't hear about it.
okay, the first
In
part of the
Lebanon?
question. Yeah, would you like to...
About
there's that,
the
Dr. Bas-
displaced people from Aleppo.
And the telemedicine.
The displaced-
Proximi. There is a group called from Lebanon, Proximi. I think it's the same. I don't know.
Well, they isolate them when they come to Lebanon, and these boils on their skin.
No, I don't.
No. Okay.
So your question about the displaced families from Aleppo.
No, the
So-
telemedicine.
Telemedicine. We do have a very robust program of telemedicine. We do ICU. We have 10 different ICUs inside Syria, managed by 15 board-certified intensivists here in the U.S., 24/7. They give orders, they monitor patients with a high-speed internet. It's been going on for 2 years. We also have telemedicine in different capacities. We have one for GI, I'm a gastroenterologist. There's one for other specialties where doctors from inside can ask questions and get the answers immediately. We have a radiologist on call to read CTs from Ghouta, which is under siege, and from other areas. So we do have a very robust telemedicine program.
Thank you. We'll have a question there, please.
Hi, my name's Rania. I work for SAMS. I have a couple questions. So my first question is, given what you said about basically the regime learning about cave facilities and then using different weapons to combat them, are you concerned that by sharing information that they'll continue to learn more and use different tactics in order to attack them? And my second question is, has anyone reached out to a research facility or a university institution to come up with innovative ways to deal with ventilation?
Kathleen, would you like to take the second question, and then we go back to the first one about if you reached out to other research organizations working on the report?
Take that second question about ventilation.
I think the research on the architectural or engineering, yes, we do. We do have collaboration with several engineering firms, undergrounds in Syria and Turkey. We also collaborate with a large collection of Syrian American engineers. They have an organization called SIA, Syrian American Engineering Association. And they put forward their criteria, their specs for full protection, even though their ideas are very expensive. But I think it's worthwhile, and we need some funding to be able to fully implement their recommendations. What was the first part? Two parts of the question.
But the first part again, please.
If you disclose the information.
Yeah. That if they disclose information, would that put them more at risk than they already are?
Yeah, that's a very important conversation, and that's actually one that medical organizations are having at length right now. There's different, it really is kind of different theories. Some medical, if you're talking about sharing coordinates of facilities or sharing information about how facilities are fortified.
Sharing about the details about how you're protecting them.
And so that's something that when we were putting this report together, particularly working with some of the engineering groups that helped contribute immensely to our fortification section and the details of exactly the measures that are taken for the different models of underground hospitals. So as Dr. Bassel was saying, there's 3 typical models, and they're used in different geological areas. They're used with different areas that need certain types of services. And so we made sure to work with the medical organizations as well as engineering groups to limit the amount of information that we present to make sure that it is secure.
Yeah, I can assure you, this is not the first draft. The first draft had much more information on it that we had to really delete, not to give the perpetrators any more accurate information that they can use. So what is disclosed here is pretty safe, we feel.
If I could just add to what Kat was saying, the point that I think you started to say, that maybe you didn't directly ask about, but in terms of the location of any of our facilities, that's always something that comes up in the political negotiations, so in Geneva and otherwise, where they mention, okay, we want to protect civilians, so give us the coordinates of where your hospitals or where your schools are. And people on the ground are always incredibly hesitant to share that kind of information because they don't trust, frankly, who that information is going to, including the Russians, who are oftentimes demanding that so that they can say they can avoid hitting those locations.
You saw this hospital, MSF hospital. This is the information of this hospital has been sent by MSF in critical details, and this is the outcome.
Please, the lady in the front.
Alex Breha with BINA, and I wanted to first follow up on that, the last question. We represent an engineering firm that works in Syria and has worked on a lot of the SAMS hospitals, and we believe that the report has done a nice job of allowing the information that can be shared to be shared while also protecting people inside Syria. And it's a hard balance, and we think the report's done a nice job of doing that. And in terms of the ventilation, we know the answers. It's a matter of cost and feasibility. A lot of it comes down to, can you get the equipment in that's necessary and get it installed? There's a lot of smuggling that happens in order to do that kind of work. So the answers are there. It's just a matter of actually implementing, and a lot of that comes down to cost and will. But I want to ask the group, and Jomana started this, and I would just like to boil it out a little bit further. Based off the report and your experiences, if you could go to Congress tomorrow and ask for one thing, what would that be?
Don't ask me such a question. I don't trust any politician, to be honest.
And let me also add to that.
I need them just to keep silent. That's better.
To make it maybe even more complicated, how linked are those recommendations to the political situation? Meaning, if there is something that changes tomorrow morning and there are different developments, there is a new agreement, a new ceasefire, would you change your recommendations? Or you're saying we need those recommendations no matter what happens tomorrow? Are they linked to the political scene, or no, you think this should happen no matter what will happen tomorrow in the Syrian conflicts?
Well, now the necessity for underground hospital, for protected hospital is high priority, the first line. And this is we have to work on. We have to protect our staff, our people, otherwise things will be disastrous. There is no way, so we are not waiting for anybody to protect us. We are working on protecting ourselves by any means, with any type of collaboration. Syrians inside Syria, let me say it, totally desperate from any political or only all of those politicians over all the world. We don't believe that there is Syrian friends in reality in terms of politician. In terms of people, yes, there is everywhere in the world there are Syrian friends, honest Syrian friends.
And if there is one, I mean, Jumana, do you have main ask for the Congress?
I mean, I would hope that we wouldn't need these underground hospitals if the ceasefires were actually taken seriously, and if the de-escalation zones, or whatever they're calling them, no-fly zones, et cetera, safe zones, if that was actually a reality, then we wouldn't need these hospitals, and we wouldn't need to continue the funding, you know, asking aid to continue to fund humanitarian relief and continuing this sort of Band-Aid mode that we've been in for the last 6 years.
Well, I'm a physician, so I believe in prophylaxis, so prevention. I think preventing the attack, stopping the attacks, most cost-effective makes sense. I still believe in the politicians and the American system. So I'm hopeful Congress will respond to my humanitarian request to stopping the attacks on the civilians. That should be priority number 1, 2, and 3. What we're doing here is a reflex, you know, just it might work for now, but might not work for the future. It's not a good place to have all your hospitals underground for future Syria. But we have to do it because the international community has not responded to our calls for protection for more than 6 years. Thank you.
And I would just agree with Dr. Basil that prevention is 1, 2, and 3. But I would say that under that, with what Congress and what the U.S. government can do in terms of funding, there's right now quite a rigid divide between emergency humanitarian funding and development funding. And for the health sector, rightfully so, activities in the health sector are being funded as emergency funding. But there's programs and activities like underground hospitals that are considered infrastructure building, and that fits into long-term development funding. And this humanitarian development divide is leaving quite a large gap for activities such as this that have the short-term aim of protection, but can also be sustainable in the long term. So I think that USAID really does need to identify and deal with the regulations that prevent funding from going to projects such as this, because right now there are no government donors that are funding underground hospitals. It's coming from institutional UN funding, like the Humanitarian Pool Fund, and from private funders. And then I would also say that more direct, flexible funding to Syrian NGOs like the ones sitting up here who are, and like Bina, who are on the ground actually implementing these activities.
Can I add one more thing to funding? I think we need to look at direct funding, as Kat said. We are very cost effective as SAMS. Our cost per patient is less than $8, which is unheard of because of the thousands of volunteers and us knowing how to operate in Syria in a cost-effective manner. So eliminating the middleman makes big sense, especially with the tight budget that the current administration is proposing. So I think direct funding to Syrian American NGOs that have been around for many years, that have a good track record and saved thousands of lives.
We have time for one more question. Please, the lady in the front.
I'm Bethany Allen Abrahamian with Foreign Policy Magazine. Can you talk a little bit more about why hospitals are being targeted? It seems like just a total frontal assault on civilians. And just what are some of the reasons that the Russians even are doing this?
Sorry, what was the question?
Why they target hospitals?
Okay. It's an attack on civil life in Syria. As I said, there was the peak of the attacks in December of last year, coincided before forceful displacement of people of eastern Aleppo, up to 400,000 people. So they destroyed all hospitals, 100% of the hospitals. That was followed very quickly by immigration displacement of population. And then the other one they did before in April was also they attacked the evacuation routes and hospitals to maximize civilian casualties. So for them, this is the same way they attack schools, the one schools I alluded to, 36 teachers, students, and bystanders were killed, and immediately all schools in Idlib were closed for weeks. And then people moved to basements. Now they have smaller classes scattered around that village or town just to continue their education. It is one way to prove that you cannot have a normal life outside the government-controlled areas.
If I could just add, I mean, since 2011, when the peaceful protests first began in Syria, we've seen, continuous systematic egregious attacks against civilians, humanitarian workers, and civil society workers. It's been very deliberate. When you look at the places where the Russians and Assad regime are targeting, they're targeting schools of children, they're targeting hospitals and any infrastructure. You have to remember that these hospitals, they're a source of life for the people. So often you don't just have a hospital and no people around it. People are actually only living around hospitals because if they need medical care, they need to be able to access a doctor. And that's really, it's come down to very basic needs of life. They need to live around places where they can buy food and where they can have access to doctors because they're constantly being bombarded, and so they need to have access to aid. And so any areas like these hospitals or these schools, they're the number one places that they're hitting because, like my colleague said, they want to make it impossible for life to exist outside of government-held areas. They either want to push people to go into government-held areas, where many of them can't go because they will be arrested or targeted, or they're going to flee the country and go, and now as you see many of the neighboring countries, almost every single neighboring country is not taking in Syrians. Lebanese, Jordanians, they closed their border a long time ago, and now the Turks have become incredibly strict with their borders. And so it's really leaving them nowhere else to go except to stay in these places and potentially be killed.
Well, let me add something for hospitals. When you are targeting hospitals, you are depriving people from, this is basic care, basic medical care. It is very essential for all of the humans. Let me say it in other words. If we are dealing with refugee crisis and talking about Syrian refugees crisis. Protecting hospitals is part of preventing people from leaving the country. I will end by this story. It's my personal story. I've been in one of SRD hospital. It was Friday noon. And this hospital was targeted first and second and third time. And I went out of the hospital back to my hospital. I will never forget this issue. I found the brain of a human on the street. I took it, put it in small plastic like yogurt box and take it back. Maybe this brain was for Einstein. We don't know. This is the reality. For that reason, to be honest, forgive me, I'm so pessimistic from the politician. Sorry. Thank you so much.
Thank you all for sharing your stories and the very informative presentations. Thanks again, Kathleen and Natasha, for working on the reports for SAMS and the Syria campaign. Please, again, we have hard copies, and also I want to mention that we have special guests. We have Mr. Hazem Rihawi. He is the co-chair of the health cluster in Syria. He also worked on that, so please also approach him if you have any questions. And thanks again, and hope to see you again in other events. Thank you very much.